So just to run through the physical symptoms of stress, and again, a stress response is just something that happens in our bodies when we are faced with a threat. And so that can happen very quickly if we're faced with, our kid running out in front of a car, we all of a sudden will go into that stress response. Or perhaps if we are going to an interview, our body will also initiate that stress response. And as humans, we're designed to cope with that stress in small amounts over short bursts of time. But what our bodies and our minds are not designed to do is to cope with that chronic, prolonged experience of stress that we've all had. So the physical symptoms of chronic stress are things like having aches or pains, maybe getting headaches, maybe noticing that you've got a racing heart, feeling really exhausted, having high blood pressure, lower libido, lower immunity, so getting coughs and colds a little bit more often. The emotional signals of stress are anxiety, depression, maybe having panic attacks, that kind of stuff. And then you might notice behaviors as well. So an increase in addictive behaviors, things like gambling, drinking, using drugs, overeating, compulsive shopping, compulsive sexual behaviors, perhaps smoking more, that kind of stuff. And so they're the symptoms, the kind of very common symptoms of chronic stress. So if you're noticing that in yourself or in your team, what can you do about it? So the first thing is to create your own unique stress management plan, and everybody is going to be different. What works for one person is not going to work for somebody else. And so if by all means, if getting up and doing yoga at 5 o'clock in the morning helps you, then do it. But if you're like me and you're stressed, what you really need to do is prioritize resting a little bit more, making sure that you're getting enough sleep, because I turn into a bit of a gremlin if I don't have enough of it, especially if I'm a little bit more stressed. So if you're like me, just prioritize giving yourself an extra half hour or an hour in bed if you can. So doing the things that allow you to relax might look different to somebody else, and be aware that we're in a culture at the moment that's very widespread throughout our world of overworking. And sometimes it might feel like actually what we should be doing to manage our stress is getting up, doing yoga, going for a run, going for a walk, taking that time to cook a healthy meal. But do what helps you. Don't look at social media and learn about what helps other people. Do what helps you. And then another important thing is, as much as it feels like it's the best thing to do is to kind of throw out every routine that we've built over the last year or so, it's actually really important that we stick to a little bit of routine at the moment. As I was saying, when we're going through times of transition, that brings uncertainty, and our brains as human beings crave certainty. They feel safe with a little bit of certainty. So you might have an increase in kind of socializing over the next little while, but if you can just stick to your morning routine or your lunchtime routine or your nighttime routine a little bit, that will really help your brain to kind of tolerate the uncertainty that you're facing.